So today, most patients will ask the question, do I have to stay on lenalidomide maintenance until progression? That is, from the patient perspective, a very important question. Although lenalidomide maintenance is very well tolerated, it is associated with side effects. Patients can get diarrhea, they get GI disturbances, and they feel fatigued. The French, for example, limit maintenance therapy to only 2 years. The Europeans limit maintenance therapy to time of plateau or until they have a very low threshold for stopping it. The American study, CLGB 100-104, was actually done until progression. And based on the evidence, we think that that should be currently the standard of care. Notwithstanding, there are a variety of studies now being planned in which patients who have repeated MRD negative tests will be offered, 1, the opportunity of stopping lenalidomide therapy, or 2, participate in a clinical trial where half the patients will stop lenalidomide therapy and others will continue.